Hey, we're now at the OSMC in Granger, and I'm here with Lauren, who is an occupational therapist, as well as a certified hand therapist, and we're gonna be actually doing a live demo. Lauren, can you tell us a little bit about it?
Sure. Today I'm going to be fabricating a custom orthosis, and the type that I'm going to be making today will protect your thumb and your wrist. So a lot of times we'll do it after specific surgeries or if somebody has an acute injury.
Awesome, thank you. Let's do it.
So first, the material starts out rigid. We heat it up in this water bath and it becomes nice and flexible. I'm going to slide this on your hand so that it doesn't stick to you.
How long have you been an occupational therapist for?
I've been an OT for 12 years and I've been working here for 8 years.
That's awesome. What does schooling look like for that?
So currently it's your master's degree. So I did my bachelor's degree at Indiana University in Bloomington, and then I got my master's degree at University of Indianapolis.
That's awesome. Did you always know that you wanted to be an OT, or did you have a different path in mind, maybe when you were younger or like in college?
I knew I wanted to do something in the healthcare field. I'm gonna have you rotate palm up. And it did take me some time just shadowing different professions. And then I landed on OT, primarily because you can work in several different settings. So that really drew me to that, as well as being able to kind of form that relationship with each patient.
What are some settings that OTs usually work in?
So there are different settings like the hospital. You can work in school systems. You can work in outpatient facilities like this, where we specialize like in orthopedics, and also some different like neuro-based fields. So if people have had a stroke or a brain injury, a lot of times we are involved in that recovery as well.
Can you walk me through the process of what you're doing right now?
Sure. So as this material cools, it becomes firm again. And so what I'm trying to do as it cools is to just position it in the proper position to allow for the best healing.
And is this something that you would put on someone after an injury, or what kind of circumstance would happen for someone to receive something like this?
This would be, after an injury, specifically to the thumb or maybe your wrist. A lot of times we do this type of custom orthosis after a surgery for thumb arthritis, and I would say that's the most common diagnosis that we do that for.
Awesome. And do the patients usually wear this for a while after, and like how long would they be wearing it for?
Yeah, they typically would wear it for about a month or so, and then as they are allowed to do more activities, they can wean from it. And sometimes they'll go into something that's a little more softer and more flexible.
What made you interested in specifically hand therapy? Because I know that occupational therapy is a super wide field.
I would have to say one of my rotations that I did as a student, it just seemed to click the most with me, and I kind of like the surgical side of it too, and being able to walk people through that specific rehab.
And what was the process of becoming a certified hand therapist?
So after you are in the field for about 3 years and you're seeing primarily hand, wrist, and elbow, and also shoulder injuries would be included too, you're able to take a national exam to become certified. So through that period, it's primarily independent studying and then taking that exam when you feel ready.
That's awesome.
All right, so it's about firmed up here, so I'm gonna slide it off, and then I can make some minor adjustments just to make sure we have everything in the right spot.
Perfect, thank you.
So I'm gonna have you slide your thumb into the spot here. Yep.
Okay.
And then we're gonna attach the straps.
Yeah, so before this is really like malleable, and now it's nice and firm.
Keep you nice and protected.
Yes. How long have you been at this location?
I've been here since they opened a couple of years ago now, I guess, close to 2. I started at the Elkhart location, and I worked at the Middlebury office as well. And so now I'm in between this location and Elkhart.
Awesome.
All right, so obviously you're not able to move the base of your thumb nor your wrist, and then your fingers should be nice and free because you want those to be moving too.
Thanks so much for your time here and showing us everything that you do at OSMC.
No problem, my pleasure.
Check out the links below to see our other videos that explore more at OSMC.